This is the Physical Activity Researcher Podcast, a podcast for researchers of sedentary behavior, physical activity, and sports. Join for a relaxed dialogue about research design, practicalities, and, well, anything related to research. Learn from your fellow researchers useful and relevant information that does not fit into formal content and limited space of scientific publications. And here is your host, researcher and entrepreneur, Ollie Tikkanen.
Welcome everyone. We have a very interesting guest for today's episode. She's working as a senior researcher at University of Witwatersrand in South Africa. She has published over 100 peer-reviewed papers, and she has been in the consensus panel creating the first South African 24-hour movement guidelines for children. Ladies and gentlemen, I am honored to introduce our guest, Dr. Catherine Draper. Welcome, Catherine.
Thanks for having me.
Yeah, thank you for taking the time for this podcast. So how do you divide your time at the moment between teaching, grants, writing papers, etc.?
So I'm in a research position, so I only do a very small amount of teaching. I do quite a bit of student supervision, and generally the projects that I've done have involved students. So the work with students kind of overlaps with research time. At the moment, I spend probably most of my time looking for funding. So that involves writing grants, and I'm also involved on the board of the International Society for Physical Activity and Health. So that takes up some of my time as well. And also then trying to write up the results of the projects that we've done. I'm involved in a large randomized control trial at the moment. So working with the team on that, and kind of helping keep track of how that research is going and writing up some of the preliminary results is quite a big part of what we're doing at the moment. So lots of writing grants, trying to write lots of papers, and supervising students is a big part of that. And then also with the guidelines work, more recently that's involved some dissemination. So we've been doing some workshops in different parts of the country, and also just presenting at different meetings and that to try and get the word out, particularly with community-based organizations who work with the age group that we're interested in.
And you said that writing a lot of funding and grant application. How is the situation in South Africa for research funding in the field?
It's pretty dire. So we have fairly limited options in terms of the research that we can apply for. So I'm a soft-funded researcher, so we're particularly interested in grants that will provide salary funding. And unfortunately, a number of the grants that we are eligible for in South Africa don't include any salary funding, partly because they're linked to state entities. So for the most part, we're applying for international funding, either from the UK, from the US, and so we kind of forced to, in many ways, kind of compete in the international market for research funds, which makes it quite tricky. For some of the research translation work, I've opted more to look at more corporate social investment funding that's enabled us to produce and disseminate the guidelines. So there's different funding sources, but certainly for the really big projects, we look at international sources of funding.
Yeah. And you said that you are doing randomized control trial. Could you tell more about that?
So it's part of a multi-country study or big project called the Healthy Life Trajectory Initiative, which is funded by the Canadian Institute for Health Research, and in our country co-funded by our Medical Research Council. And it involves Canada, South Africa, India, and China. And the aim is ultimately to positively influence the health and development of young children, but actually by starting pre-conception. So working with young women before they've had a baby to help her optimize her health, so that she can have a healthier pregnancy and so that the child can be healthier. And it includes various aspects around their physical and mental health. So physical activity and sedentary behaviour, sleep are some of the behaviours that we particularly target for them. And the site for the South African part of that project is in Soweto, which is a very large and diverse area in Johannesburg. It's mainly a low-income population. So we're still in the relatively early phases of the project, recruiting the initial group. And the aim is then to follow up the woman through pregnancy until the child is 5 years old.
Mm. And you've been doing quite a bit of research within low-income settings, and I think most of our listeners are probably doing research mainly on urban setting and people who are quite well off. What kind of things you need to consider when you in rural areas or low-income
generally
settings?
in South Africa, in both urban and rural low-income settings, poverty is still a really major challenge. Because of the history of our country in South Africa, certain population groups were heavily marginalized and so kind of placed in geographical areas where they were put at a disadvantage. And unfortunately, many of those disadvantages still persist. So the rural areas are typically underserved. They, far away from services. Often, basic amenities are often lacking. So in some of the areas we worked, schools don't necessarily have running water or electricity. Facilities are really, really basic. And unemployment is really high. So parents are in a really difficult position to raise their children. In urban settings, in different parts of South Africa, it looks quite different, but some of those challenges definitely still persist. And in both urban and rural settings, food insecurity is a really big problem, along with things like crime and violence. Again, kind of unemployment and just a lot of the kind of socioeconomic challenges that are evident in those settings. And the challenge that poses for us, particularly as physical activity researchers, is that health more generally and physical activity more specifically is often really not top of the priority list. People are just trying to kind of get by and survive, and trying to find, safe places to walk or nice places to walk is certainly in urban areas a real challenge. Women are often, it's often much more difficult for them. And in rural areas, we do find that people are quite active, often because they do need to walk quite far distances. But a lot of the research, particularly in South African rural areas, has shown that a lot of that activity is at quite a low intensity. And so it doesn't necessarily have the kind of optimal health benefits. So in both these urban and rural low-income settings, the prevalence of non-communicable diseases is really high, and very much kind of a part of normal, in inverted commas, life for many people. So things like hypertension and type 2 diabetes, cardiovascular disease. So even though the settings are really low income, NCDs is a problem. And then on top of that, HIV is a major issue in South Africa. I think we have the highest prevalence in the world as a country, and kind of a comorbid condition with that is tuberculosis. So physical activity and health is not often kind of really high up on the agenda. And obviously that then translates into kind of various policy issues and trying to get the attention of policymakers and practitioners, in the face of kind of so many other health and social challenges and economic challenges. It's quite difficult to get physical activity up there, even though, most people acknowledge its benefits. It's just the feasibility of kind of implementing programs, and that is often just really challenging. And so in the work that we've done with young children, particularly in the preschool age group, we find that we've then got to find what are the key issues for that age group that will kind of get people to listen and take notice. And so we found much more that cognitive development and school readiness are kind of key issues in terms of preparing children well for school. And that still remains kind of a top priority for parents and caregivers. So a lot of what we've tried to message around, even in terms of our guidelines, is how can these support and help children to be set up best for school, to be on the best trajectory for their health and their education, and what role do movement behaviours, for example, play in supporting that. So it's important to kind of find what the salient issues are and see how can physical activity and health be integrated into that, knowing that physical activity and health on its own is probably not going to get anyone too excited.
Yeah, so very challenging environment. And do you usually do qualitative or quantitative work? How do you do the practicalities in this such challenging conditions?
Yeah, so we do a mix of both. My background is initially in psychology, and all my research up to my PhD was qualitative. So I'm very much a social scientist at heart.
Yeah.
And I've found that for the projects that we've done, really starting from a qualitative perspective and just getting a sense of what people have to say about these issues before, planning interventions and developing things, I think is really important. I've got much more into kind of the measurement of behaviors, but often the measurement without the social context around in which those behaviors happen, it doesn't mean as much. So I think there's huge value in both. And a lot of the intervention work that we do, it's also a combination of both methods in terms of understanding an intervention's kind of feasibility and how it's accepted, and does it resonate with the people that you're working with. I think the qualitative methods really help us to get much greater insights into those kind of things. So a good mix of both. And obviously something like cognitive development, and we really want to make sure we have robust measures of those kind of outcomes, and those tend to be much more quantitative, and we've managed to find some really good measures that we use. But then kind of understanding how would we change those, or how do we understand the environments that those kind of things take place in, like preschools or schools or homes. The qualitative really helps to kind of then fill in the gaps about how do we actually explain our results.
That's very interesting. Let's have a short break and hear a few words from our sponsor.
This podcast is sponsored by Fibion, a research device that has been shown to be valid in tracking sitting, standing, physical activity and energy expenditure. Furthermore, Fibion has been shown to be valid categorizing physical activity into light, moderate and vigorous intensity. In addition to scientific accuracy, Fibion provides automatically produced and easy-to-understand reports for research participants. Get scientific validation and learn more about Fibion at fibion.com/research.
All right. So you were saying that you have found good measures to measure cognitive development and motor skills. What kind of measures are you using?
So for the gross motor skills, which is something that we've tested in preschool children, we use the test of gross motor development, the second version, which is an American tool. So it has American norms, but it is widely used in research in a number of countries. So it does help make our results somewhat comparable. And then for cognitive development, we're particularly interested in executive function. And we use something called the Early Years Toolbox, which was developed by colleague Stephen Howard from Early Start at the University of Wollongong. And we've worked with him for a number of years and have translated the tool, which is an iPad-based assessment. So we feel it works really well in our settings. And then we have a locally adapted tool that we use to assess school readiness. Yeah, and all of those are then done directly with the children.
All right, so you have launched the first guidelines for South Africa for children, for 24-hour movement guidelines. Could you tell more about these guidelines?
Okay, so as you may know, in Canada and Australia, their early years guidelines were updated in the last few years, and they were the first countries to do that. And we were very fortunate to have Professor Tony Oakley, who led the Australian guidelines, to help us in our guideline process. So we convened a local consensus panel that included researchers, practitioners, ECD or early childhood development experts, some NGO representatives, government representatives, and worked through that process last year. Tony and myself and a few of the other country guideline leaders were actually part of the WHO guidelines for the early years as well. And we were fortunate enough to be able to have access to the systematic reviews that were done for the WHO guidelines, and also considered the local evidence that we had available. And that first meeting took place in April last year, and then we also went through a process of stakeholder consultation. So what's different in South Africa is that we're not able to rely on an online survey for getting stakeholder feedback, since internet access is not something that a large majority of South Africans have access to easily. So we did some focus groups as well, particularly in low income settings, and through the government representative that we had on the panel, we were actually able to present it to representatives of national government and NGOs that they work with nationally as well. So got really positive feedback from that, and then launched the guidelines in December last year. And then through a little bit of funding that we've had with the colleague, Dr. Esther van Slees in the University of Cambridge, we've been working on disseminating these guidelines and evaluating this dissemination. So this month we've been doing a series of workshops with representatives from community-based organizations who work with 0 to 5-year-olds. So just educating them about the guidelines, distributing the printed resources that we have. So we have the guidelines as a kind of a more formal text document. But again, because literacy is a challenge in South Africa, we developed an infographic about the guidelines, and we've had that translated into the 10 other official languages of South Africa. So we have 11 in total. So that was a huge job. But that's meant that we've been able to then distribute this in all the languages of South Africa around the country. And even though the infographic is mainly pictures, obviously the explanations are then in the different local languages. So we're actually in the process today of running the last workshop in one of the provinces. And then we're also working with some other partners. We've kind of met along the journey to develop some more kind of creative resources. So with some colleagues from Stanford University in California, we're working with them to develop a short little video that we'd be able to distribute easily about the guidelines. And then with some other colleagues in Johannesburg in South Africa to actually develop some more musical, what do you call them? Like products to kind of almost, they use an approach called musical storytelling. So it's just to make it fun and creative as something that we can distribute around South Africa. And for us, online resources are available to kind of a very small percentage of the population. Data is expensive, so people often don't have the ability to kind of download and print documents. So to have things that are kind of short and small to send around on smartphones, or even just regular cell phones, so not ones with internet. Those are all kind of considerations that we have to take into account. And, what are we able to get out at a community level that can be distributed easily and cheaply, and that will kind of use some of the kind of the cultural richness of music and storytelling in our country that can appeal to more people than just kind of a printed resource. So it's a growing process. Obviously, when you launch the guidelines, it's a completion of one process, but starting the dissemination of another one. But it's been really, really encouraging to see the positive response we've had, particularly in low income settings where levels of awareness around what is too much screen time, or how much time should kids be active or what's important about sleep, to be able to share that kind of information, because we don't just want to hand out resources. We want people to understand why the guidelines are important and how these can influence children at such a foundational time of their development. And we just had a really positive response to that, and people have been really supportive of disseminating them. So it's been a great opportunity to kind of see the research that we've done and the evidence that we've gathered actually be kind of put into action, and to be able to, even if it's a really small difference, but kind of using that science to make a difference at a community level, has been really, really encouraging to see.
Sounds very interesting and impressive. So you had many stakeholders. How difficult, how easy it was to get different stakeholders to work with you?
So I guess it's the putting together the consensus panel wasn't too difficult. I mean, there were a number of people that I knew and who kind of working in the early childhood development space in South Africa. But it's just to get people in one place for 2 days was as you can imagine, is tricky. We obviously wanted much more government involvement. We were only able to get one person who agreed to come, but she was incredibly influential, and she's been unbelievably supportive. So she's really helped to open a lot of doors for us and kind of give us opportunities to present. And then we were just also quite strategic about who we invited to be part of the consensus panel. So certain organizations that already have a really good reputation around early childhood development, people who've been, working in this field for many years, helped to kind of lend credibility to the process and credibility to the guidelines once we actually had them produced. And because we had them involved when it comes to dissemination, we've been able to kind of really get a head start in terms of tapping into the networks that they already have. So not having to kind of start with a blank piece of paper and say, right now, who do we get in touch with? We started with a massive spreadsheet of names and contact details of people who are already on their mailing list. And then through these workshops that we've done, we're obviously kind of creating an even stronger network. So I guess, one thing I've learned in South Africa is that most people who work with young children are really nice people.
All right.
So it's usually a really cool bunch of people to work with anyway. And a lot of people know each other already, if you're getting in some of the more well-known names. And so people have been quite happy to work together. One of the things that was challenging is that, and I don't know if this is an issue in other countries, is that researchers are often kind of dealt with quite a bit of skepticism by people who work in organizations and government, because there is often this perception that researchers just kind of sit in their offices and do research and don't really get out into communities and don't see the realities of what's out there. And so it did take quite a bit of kind of proving that while we were the researchers sitting in our offices, that we had not seen everything, obviously, but that we had some insights into what the real world was like out there in terms of young children in South Africa. And like I said before, with all these other challenges, talking about physical activity and screen time in settings where safety is a major concern. Trying to get people to understand why is this a priority issue, and it comes back to then saying, well, what is really important to people? And everyone says, no, we want our children to go to school, we want them to do well in life. So it's then positioning the movement guidelines as to, well, how do these behaviours actually really help make that happen? So if you're wanting to set your child up for their best, educational future, like what are the things that you need to start doing in this age group? So it's certainly taken a lot of, phone calls and meetings and Skype calls and emails, to connect with stakeholders and ultimately, work in partnership with them. But I think it's in South Africa, it's a really topical issue, and I think it's something that, early childhood development is something that's really important to many people, right up to our president. So the issue itself is quite an easy one to get people around the table. But then it has been a case of introducing these movement behaviours as kind of a research initiative, and we very quickly threw out the term sedentary behaviour because no one liked that.
Yeah.
And you realize it's a term pretty much used only by physical activity and sedentary behaviour researchers, and so it's been also saying, well, what's a language and what are terms that people are actually going to understand, and for us, because of all these different languages and because of literacy challenges, kind of having to then explain things in kind of the simplest of terms, being sensitive to different kind of cultural differences. But for the most part, it's been really, really positive.
Yeah, and it sounds like quite a bit of its dissemination of the results. So how do you see the role of researchers in general? Should they be doing the dissemination, or should they just be doing the research and someone else doing the dissemination in a way?
Yeah, and that's a really good question. I guess because I'm still at that stage of my career where you're kind of doing a bit of everything. I don't have a team of minions to go out and do it for me, and you've often got kind of very little bits of funding to kind of stretch as far as possible. So I think ideally you do want to have different teams that play to their different strengths. And I know certainly the people we've met around coming up with these creative resources, they have ideas and marketing perspectives and all of those kind of things that, we're just not trained in necessarily as researchers. So it's really great to meet people who bring those strengths. So I think there's definitely value in, having people work on dissemination, that's really what they're good at. But for me, and I guess I like working in communities, and I like, rolling up my sleeves and getting out there. I think that when you do the dissemination and when you engage at a community level, that feeds back into your research. So when you meet people and the kind of questions that people ask and the things that you talk about, that gives you ideas for what research you can do in the future. I think it adds depth and insight into the research that you do when you've actually interfaced with real human beings and not just kind of read reports of how things have gone or kind of seen photos or those kind of things.
Yeah, I fully see that. That's a good point. And if we go to the actual guidelines, what were the special considerations for South Africa when you made these guidelines?
So I think I mentioned the language issue and making sure that was just all really clear and understandable and easy to explain. I guess one of the main things is that in the guidelines for this age group, one of the recommendations is about children being restrained when they're awake for not more than an hour at a time. And in African cultures, it's very common for babies to be tied to their moms' backs. Sometimes to get them to sleep, sometimes to just get them out of the way when the mom needs to do something, or if she's got to walk to the bus or the taxi or whatever, the child's got to, go on her back. People don't have money for prams or strollers or whatever they call in different parts of the world. So, so we had to be really careful about how we phrased that, because we didn't want to label a particular cultural practice as something that was detrimental. So, for instance, in the infographic, we actually didn't even try and kind of put a picture of that because it would just be too difficult to explain. And the small amount of research we had suggested that wasn't the most pressing issue, and that screen time in really young children was much more of an issue. One of the other things around being restrained is like being in car seats. And in South Africa, unfortunately, again, for resource purposes, like most people don't have car seats. So the government and NGOs do an enormous amount of work to encourage people to put their children in car seats. So using like not having your child restrained in a car seat as an example was, taken out very early on. Yeah, and I think also just in terms of the examples that we've used or how we explain it, that it's not meant to seem like you need a whole lot of resources to make these guidelines happen, that these are for, children from all economic backgrounds, whether you've got a lot of resources or not. These are guidelines that everyone can meet. And so making it as kind of broad and accessible as possible was really important, so that people don't look at it and say, well, this is just for wealthy children who've got toys or gardens, or whose parents can take them to the park. It's like these are things that everyone can do, and they're applicable to everyone. And we had someone in the group who had a particular interest in disabilities. And so they were at various points also just saying, how do we phrase this in such a way that this is accessible for everyone? And how do we consider children with different abilities?
Yeah. And how is the situation in relation to physical activity intensities and sedentary behavior in children in South Africa?
So we don't have a huge amount of data on kind of primary and high school age children. So the research that we've done has been particularly on preschool age children, so from 3 to 5. We actually found that children are very active across different income settings, doing, in excess of about 400 minutes of activity a day, when we're recommending they do 180. And the majority of them, certainly meeting the kind of total physical activity guidelines, and quite a high percentage of them meeting the guideline for 60 minutes of energetic play, or MVPA. So physical activity for us is actually less of a concern. Obviously, in our settings, it means that kids are often playing outside in the street, which is not terribly safe. So we know that often the activity happens in a way that potentially puts children at risk of other things. And from a sedentary behavior perspective, we certainly from the dissemination workshops, from the stakeholder input and all of that, we found that screen time from a very young age is very much a part of children's lives. And when we say, children under 2 not to have any screen time, then usually we get a few gasps and kind of big eyes looking back at us thinking, well, that's just totally not reasonable. And kind of reports of children spending quite a few hours a day. Certainly in urban areas where, for the most part, even in really low income settings, people have a TV. But as smartphones and tablets and technologies becoming more accessible, those become a really accessible thing for young children as well.
Yeah, so physical activity levels were good, a little bit too much sedentary behavior. How about the sleeping time?
So sleep, what we've found, the research that we've done with children in particularly low income settings in urban areas, is that they're not getting enough sleep, and partly or mostly because their bedtimes are just all over the place. So there seems to be very little bedtime routine. And at the preschool age, children are spending, good hour and a half, 2 hours a day napping at preschool, which helps get them the recommended amount. But obviously, as they transition into formal schooling, they're not necessarily going to have that nap. So the bedtime routine is a big issue. But in these contexts, a lot of the time, families stay in the same room, often sharing beds, and the TV's often there. Adults want to watch TV late into the night, and the children just sit there and watch as well and go to bed late. So a lot of what we've spoken about in terms of the sleep guideline is just to start instilling that bedtime routine as early as possible. often the morning kind of wake up time is quite regular because that's when people need to get to work or to school, and that seems relatively fixed. But it's the night time that seems to be all over the place. So that's certainly something we've tried to address in intervention work.
Yeah. So it seems in overall you have been doing really, really interesting project and disseminating the results quite a bit. I think we are closing the time limit. I would like to thank you for taking the time for the podcast, and maybe we can do another recording on a better time.
Sounds good. Thanks very much for the opportunity.
This podcast is sponsored by Fibion. Get scientific validation and learn more about Fibion at fibion.com/research. The Physical Activity Researcher podcast has created an activity tracker purchase guide for researchers. Get your free copy from the link in the podcast description.
Thank you for listening to the Physical Activity Researcher podcast.